Thank you so much, Marcel and the communications team. To our GMD colleagues and various Global Fund departments, our Stellar countries, as well as Stellar providers, we take this opportunity to welcome you all to today's information session on Project Stellar. Project Stellar primarily was funded originally in 2021 with the intention to reinforce COVID-19 diagnostic capacity in 23 countries that were lagging in COVID-19 testing targets in the African region. However, with the improved COVID situation, Stellar redeployed its resources to focus on integrated laboratory system strengthening, leading to the key achievements that we will be sharing with you in today's information session. Under coordination of the MOH laboratory directorates, the countries had collaboratively developed priorities for implementation as well as monitoring of achievements and results in the 23 countries in scope. Stellar aimed at catalyzing existing grants. The immense support by the principal recipients as well as the respective country teams has been quite outstanding. Notably, both the principal recipients as well as the country teams have always stepped in to resolve any arising bottlenecks as well as challenges during implementations, which is a key show of true partnership and collaboration. Implementation for Stellar has been led by 3 providers, that is CHAI, ASLM, as well as APHL. In today's session, we have 2 keynote speakers from the MOH Laboratory Directorate teams from Chad as well as from Zambia, who will showcase Stellar achievements as well as lessons learned in their respective countries. Aside from that, we'll also have an overview presentation made by ASLM that will give overview of Stellar and some of the achievements across the 23 countries. During this session, we do look forward to an enriching discussion that will eventually elicit further improvements in the quality of our programming as well as Stellar TM. We do encourage you to raise any questions or comments that you may have on the chat box, and this will inform further discussions during the Q&A that will come at the end of the presentations. To our Francophone colleagues, at the bottom of your page, you'll see an area written interpretation. If you want to listen to the presentations in French, press on the French version and you'll be able to follow the discussions in French. And with that background, I want to take the opportunity to welcome our first presenter, Mr. Silva Machete, Program Manager with ASLM, who will walk us through an overview on Project Stellar. Silva, please welcome.
Thank you, Osborne, and thank you, colleagues, for making it to this call. In the interest of time, I'll try to provide an overview, but I'm presenting on behalf of the Project Stellar partners, that is ASLM, APHL, and CHAI, just to give you an oversight of what has been happening and how. And then we are happy that we will have the 2 countries showcasing, that is Chad and Zambia. So if we could go to the next slide, this is a project that has been implemented since 2022, and it's expected to go up to June 2024. We are in 23 African Union member states. And like we mentioned before, we are 3 partners, but we have subcontractors that we work with in the different countries. Those include the AMREF, Botswana Harvard HIV Partnership, Solina Health, and others. And we have those core work areas in terms of policy, improving testing services, data system surveillance, and other lab systems. But there is a core area that also talks about conducting surveillance in the community, that is wastewater-based surveillance, and that's where APHL is providing the TA. And if we could go to the next slide, is that within those, Osborne has alluded to how Project Stella is being implemented. This is the implementation approach, and it is essentially under the stewardship of the different ministries of health lab directorates across the 23 member states. And what is unique with this implementation is that it is based on the country's specific needs, tailored to the needs identified by the ministries of health. So we do coordinate with the lab directorates, then identify priorities, and then we develop tailored work plans, and then the implementation. So within all this, we are able to address and provide different work areas. And if we could go to the next slide quickly, such that we are able to provide enough time for the teams. Overall, in the 5 of the core work areas, that is policy and governance, increasing integrated quality testing, data systems, surveillance, and lab systems. You see in there some of the achievement we have to date. This is as far as the overall project stands across the different 23 member states. But what is key on this slide is that these deliverables contribute to the Global Fund key performance indicators that are indicated in those dotted boxes. And this shows how integration and contribution to the broader health system stands. So the other 2 countries will be speaking more to some of these deliverables, and therefore would like not to spend a lot of time here, but this is just a snapshot in terms of how the areas to do with policy and governance, decentralizing testing, data system surveillance, and border systems stand, and some results are in there. And if we could quickly go to the next slide. We will now give you an overview in terms of wastewater-based surveillance. This is an initiative that Project Stella is providing to the country's teams to support the development and of surveillance using the environment aspect. So support has been provided to conduct SARS-CoV-2 testing in wastewater. And this is, of course, we are seeing this continue to move into the next generation sequencing. And you can see some of the photos showing you that this is happening in 6 of the 23 countries. And those are some of the processes that do happen. But the more interesting slide is on the more content is on the next slide that we would like to look at. And here you see that while we have been doing this, supporting the detection of SARS-CoV-2 in wastewater, we have seen that it is feasible to potentially expand this to other pathogens. So this provides a platform for us to be able to expand our surveillance. And for the next slide, to show you the overview of what progress has been made, if we could go to the next slide, this is the monitoring of the work plans across the 6 countries as far as wastewater-based surveillance work plans are concerned. We already say that we developed these work plans in collaboration with the Ministries of Health. All the countries have achieved that. The survey protocols, the standard operating procedures, the sample collection and testing procedures, realize that most of them are doing well. What you notice at the bottom is that some of the countries, in terms of using next generation sequencer for public health action, this is work in progress. No achievement yet, but this is considered to be coming in the near future. And there are prospects of expanding this to additional testing sites such that this can be further expanded. We would like to highlight that one of the countries to showcase this is going to be Zambia, so they provide you with more details on this. We'll check on the next slide. Now, this slide is just to give you a highlight that one of the areas we are seeing that is a need that we need to work on is developing a centralized data repository to provide insights into how we can measure the maturity of our lab systems. So this work is in its infancy stages, and will be in the near future showing more on this. But we just need to highlight that as we work, we are thinking of having a dashboard for the African region. And in the interest of time, I would like to go to the last slide such that we allow some more time to the country teams. Of course, there have been some of the challenges that we have worked to mitigate, but lastly, there are some of the key lessons that some of which the country teams will be talking to. And on the next slide, where we realize that this TA has actually supported the coordination and the ownership of these activities by the lab directorates. And you realize that in one of the work areas, we had formulation of policies and guidelines. This is very critical in shaping the direction of lab systems and really improving the coordination. So all this TA is actually very critical. And if well maintained through the next few months and in the future, we should be able to strengthen our lab systems. So we'd like to have more time to the country teams to share their experiences, but overall, that's the overview of Project Stellar implementation across the 3 member states, provided the TA by ASLM, CHAI, and APHL. And I would like to end here such that the countries give us their experiences. On behalf of ASLM, CHAI, and APHL, I would like to stop there and over to you, Osborne. Thank you.
Thank you so much, Silva, and we welcome all attendees to raise any questions or comments you may have on the chat box. Next, I want to welcome Dr. Abdelhamid Abdallah Bakar, Director of Laboratory and Biomedical Analysis Department of Ministry of Health, Chad, who have been implementing lab system strengthening activities under Project Stellar. Dr. Ahmed, please welcome.
Merci beaucoup.
Thank you very much indeed. Hello, everyone. My name is Dr. Abdelhamid Abdallah Abakar. I'm a biotechnician as a training, and I'm the current manager of biomedical analysis in the laboratory, reference laboratory in Chad. I'm honored to present you the Stellar project with a directorate, and so we'll see together the progress and challenges we met in this project. Next slide, please. So my presentation will include these different points. Next slide. Today, we'll talk about 3 main domains: policy and governance, data management system, sample referral, and transportation of the Stellar project. So we'll see the support given by the Stellar project on these areas. So for policy and governance, so there was a coordination of an implementation of laboratory activities. At the time, we needed some efforts in that field. The goal was to provide efforts on the work plan. So we wanted to avoid overlaps. And as far as data management system is concerned, we are now digitalized. So we're digitalizing different labs, especially the labs from the national network, so the reference lab network. And we also had some trainings organized, the software, and we trained different technicians. And we are going to install this software in different labs. And as far as sample referral and transportation is concerned, we were able to draft a system, and now we are implementing this sample referral and transportation system. Next slide. On this slide, we can see the different details of the policy and governance overview. As you know, the Stellar project supported the updating of the validated National Laboratory Strategic Plan, and also there was a technical working group which was established, and some meetings were organized weekly to supervise and coordinate activities. And the project also helped to develop a roadmap to align activities to all lab departments. On the right-hand side, you can see the expected outcomes, such as increased relevance and effectiveness of the NLSP, which is the National Laboratory Strategic Plan, and an improved alignment with national priorities and goals, and enhanced communication and collaboration among laboratory stakeholders. Next slide. Here you can see some pictures showing us different meetings on the right-hand side, which is at the lab directorate. And we also had a CHAD steering committee, which was held in Gemena. And we also have on the left-hand side the roadmap of the activities of the labs and biomedical analysis department. Next slide. On this slide, we talk about data management system. As I just said, the Stellar project supported the fact that we trained some lab technicians. 20 laboratory technicians were trained, and 5 laboratory admins were trained as well. Most of the time, these technicians come from the National Reference Lab Network. And thanks to the Stellar project, we also drafted an M&E plan to track data management with the lab software. On the right-hand side, we have the expected outcomes. And one of our perspectives was that all laboratories use the lab book for data management by June 2024. So once we've incorporated the software in all the different labs. And this will allow us to centralize all our data. Next slide. You can see a few pictures of different activities related to data management on the left-hand side up. And these are pictures from the training workshop on the software. And at the bottom, we also have other training workshops at the bottom. On the right-hand side, we've got the type of tools that different labs use to collect data. And so we can see that 5 labs out of 6 are paper-based. And there's just one lab. This is the Renaissance Hospital lab using the LIMS software. That is why we decided to digitalize these labs. Next slide. On this slide, You can see the different sample transportation activities. We have developed a manual on sample transportation and its implementation. And also, thanks to the Stellar project, we were able to develop a monitoring tool on the gaps of knowledge for the staff of 10 different labs in order to see which are the required skills and capacities needed in terms of samples. We have also identified 3 provinces at first, the Guéra, the Western Logan and Gemina provinces, who need to be updated. So we are going to, in near future, implement this sample transportation system. And we've also defined key locations for piloting the new sample reference systems. Next slide. Here, you can see the different analysis reports of the use of GeneXpert device. And you've got also the operational plan on the right-hand side in terms of reference for TB and HIV. Thank you. Next slide. And again, more documents that we were able to draft. You can see the training curricula and also the training program document. And we also have an image showing specimen referral knowledge gap assessment survey tool. We haven't gone on to the implementation yet, but that's what we are trying to do right now. We also have terms of reference to assess SRS knowledge gap. Next slide. As far as challenges are concerned, we've identified these challenges here. There is a delay in digitalization of laboratory data management, and the root cause is a delay in procurement and distribution of hardware. About the considerations where we want to improve communication between the PR and the directorate. Also, another challenge is we've got a delay in conducting specimen referral knowledge gap assessment. The root cause for that is a funding challenge. The activity wasn't included in the Global Fund approved budget. So that's the main cause. But among the actions taken, we've scaled down the assessment to 10 labs to reduce costs. And there's a need for knowledge gap assessment to support development of a targeted training curriculum. And as recommendations, we've got 3 recommendations. Next slide. As I said, these are our 3 recommendations. Implement a streamlined disbursement protocol for funds allocated to laboratory management activities. And number 2, we want to provide continuous technical assistance support to the Ministry of Public Health and Prevention, because we've got quite a few meetings, weekly meetings or meetings with a National Reference Lab Network or the Gene Expert Network as well, meetings. But sometimes it's a bit hard to facilitate a good management of the directorate without a good management of funds. And the third recommendation is we want to, as I said, provide continuous technical assistance support to Ministry of Public Health, because we have different projects, ongoing projects. So especially, we've got biosafety data and SLIPTA accreditation, and also we want to have a lab mapping. Thank you very much indeed. And that was my last slide. Thank you. Thank you very much indeed for your attention.
A big thank you to the CHAD team, Dr. Bakar, and for being precise on time. And with that, the next presenter, I wish to welcome Dr. Shilufya Mulenga, the field epidemiologist, as well as the wastewater surveillance focal person for Zambia National Public Health Institute. Unfortunately, Mr. Devin Summer was not able to join due to other competing priorities. And for that reason, Dr. Shilufya stands in for him. Dr. Shilufya, please welcome.
Thank you, Chair, and thank you. And greetings to everyone on the call. I'll straight away go into the presentation since I've already been introduced. Okay, so we'll look at the wastewater-based surveillance project implementation and coordination. So this coordination among, this was a collaboration among the principal recipients, which was Ministry of Health, together with Zambia National Public Health Institute. And the Church Health Organization, Church Health Association of Zambia, CHARS, and then other stakeholders. The idea was to leverage on the existing system for this surveillance that we're embarking on. So these covered the procurements. So where we had to procure equipment, reagent supplies that were needed, specimen collection and transportation. Then also the laboratory PCR and next genomic sequencing testing. Then there was also a component of data management. So there was need to provide regular updates to the stakeholders and the Global Fund as scheduled for the countries under Project Stella. So we used to have monthly meetings for this. Can kindly move to the next slide. Okay, so under program harmonization, so the stakeholders collaboration focused on different areas. So for the Ministry of Health and the Zambia National Public Health Institute, which were the principal recipients, the main function was really to provide the project oversight and then also to support PCR testing, next genomic sequencing, data analysis, the dashboarding, and then the trainings as well. Then the Churches Health Association of Zambia, so their role was to ensure the procurement of the PCR and the next genomic supplies for the lab was done. Then there was also were involved in the support of transport. That is, they were responsible for ensuring that there was fuel and the driver for the sample collectors on the particular day that the samples were to be collected. Then there also sample collection, then PCR. Then they were also responsible for the next genomic sequencing, dashboarding, and data analysis trainings as well. Next slide, please. Okay. So APHL, these were providing technical assistance. So mainly the responsibility was to provide technical support and the project coordination at large. Then they're also involved in the procurement of the sampling, PCR, and the next generation sequencing supplies. Then they also supported and coordinated the monthly meetings and the trainings that were scheduled. Then they provided Ministry of Health with logistics for transport, sample collection, and testing. Then there were also other stakeholders that were involved in this wastewater-based surveillance for SARS-CoV-2. This also included the Lusaka Water Supply and Sanitation Company. So whose role mainly was for us to give us access to the wastewater sites and also to just be there when sampling was done. And it's also the Zambia Genomic Sequencing Consortium, which used to do project reviews for the project, and they would have monthly meetings. Next slide, please. So the project roadmap, firstly, was to ensure that we had the labs were prepared. This was done in phase 1, that was about February to April. And then secondly, we moved to phase 2, that was between May and October, where we looked at the capability development, where we assessed the lab, and then the readiness. Then there was also development of the protocol. So the protocol that we developed was not necessarily for SARS-CoV-2. However, this included other pathogens as well. So we developed this umbrella protocol, and we got authority for this research to go on. Then the phase 3, this ran from November to February. This involved data sample collection from the sites that were identified, and then running of these samples in the lab, then result reporting and communication of these results. Next slide, please. So what was involved in the laboratory and environmental assessment? So we assessed 3 labs. These included the Zambia National Public Health Institute Reference Lab. Then we had the University Teaching Hospital Virology Lab. Then we had the Church Health Association of Zambia Lab. So these 3 labs were assessed, their capacity to support PCR and NGS. So basically what was involved was looking at the availability of the infrastructure, then the staff, and then what training, the staffs that could be involved in this wastewater surveillance, and then also the training, the capacity they had, what training needed to be done. Then we also looked at the equipment and the supplies, what equipment was available, what supplies needed for us to ensure that the samples that were collected were tested and we had the results in good time. Then there was also data management that was also assessed the capacity of these labs to ensure that this data is digitalized and is able to and communicated to the relevant authorities. For the environmental assessment, this involved assessing of the sampling sites, and then the sample collection as well, then how these samples were to be couriered from the collection sites into the lab. Next slide, please. Okay, so for the protocol development and fund support, like I mentioned earlier, we prepared an umbrella protocol, and this was approved by the National Health Research Authority. So APHL was involved in ensuring that this was done. So they coordinated the meetings, like the first picture on the right, that is one of the meetings in which we were preparing this protocol, and they ensured that the funds that were supposed to be paid to the research authority was done. Okay. Then after that, we went ahead to seek for authority to access the sites. And then this was obtained from the Sanitation and Sewerage Company, in this case, the one based in Lusaka district, because this is where the pilots were supposed to be done. So when it came to site selection, 6 sites were selected. And then because we had 2 labs to which the samples were supposed to be referred to, so we had to zone these sites. So 3 sites, which included Chunga, Mass Media, and Matero ponds. So samples from these sites were to be sent to Zambia National Public Health Reference Lab. And then samples that were coming from Machinchi, Kaunda Square, and Chilston ponds, these were supposed to go to CHAS Lab. So secondly, on the funding and the procurement mechanism, so procurement of the sampling materials, PCR, and NGS was done in good time to ensure that as we start the project, everything was available and we could start without delays. And then we also received a donation of supplies from APHL, that is the headquarters. Next slide, please.
Chilufya, would I kindly remind you to be mindful of time, please? We need adequate time for discussions. Thank you.
Thank you. So when it came to trainings, so 14 personnel were identified and trained in sample collection and testing. So these included staff from the 3 different labs. And then also in the training, we had people from the Water and Sanitation Company. So the training involved classroom work as well as a field tours. So we had, the first day was basically classroom training, then the second day a field visit so that the samplers could have a hands-on. Next slide, please. Okay, so our sample collection was for 4 months, that is from November to February 2024. In Lusaka, from those 6 sites. And then at the end of it all, we had 312 samples that were collected and tested. So of these 312, 207 were positive for SARS-CoV-2, representing, giving a positivity of 66.3%. And then some samples were selected, and then we had NGS conducted on samples that were selected. So the lab is using a DISA lab information system. So we had the wastewater configured into this system at both labs so that we could have this information into the system that the lab was using. Next slide, please. So there was also a bioinformatics training that was conducted. So 14 personnel were trained. So these were trained for them to be able to analyze the sequencing results from the 2 labs that were involved. Next slide, please. So this is our dashboard. So this gives just an overview of our results. So on the left side, the first one, that one gives an overview of the sites where these samples were collected and what the results were. For example, the first one is Chelson Ponds. So of the samples that were collected, 36 of them were positive and 16 were negative. So then then just below that, we are seeing the number of samples that were collected starting from November to February. So on average, we had 72 samples being collected per month, and we had more in January. So the next one in the middle is just showing the summary results, where we have 66% of the samples that were run being positive. And then on the right, it's just showing the labs that were involved. So which samples went to which lab. So we had 53% of the samples going to the public health reference lab, and 47 going to CHARS lab. So then in the last row, just showing the positive and the negative results per month. And then the last one on the far right is just showing the samples that were targeted for sequencing. Next slide, please.
Tachilufia, can you wrap up in 2 minutes time, please?
Okay, sure. So from the results that we got, we tried to relate our results, wastewater results, to the clinical results. So in blue is the wastewater-based surveillance results, the positive samples. And then the one in red is results from the clinical specimens. So I should mention that the ones that we are using for clinical, these were strictly results from PCR. Next, please. Okay, so where that blue line is just showing a tip off when we started seeing a rise in the positivity of the results with regards to wastewater samples. Next slide, please. And then the red one is just, the dotted red is just showing us the increase in positivity when it comes to the clinical picture that we were seeing. So we had about a 1 week lag in place. So when we saw an increase a week later in the wastewater sample results, an increase in the positivity, we started seeing an increase in the clinical samples as well. Next slide, please. Okay. So with regards to the results for NGS, we were able to identify the JN1 variant of SARS-CoV-2. So with wastewater, we were able to identify this in November, and we started seeing this in clinical results. We had our first case in January. So this shows that in wastewater, we're able to identify emerging variants, and then that would indicate what would happen in the clinical picture. So this J1 was also seen in other clinical samples from other results from the other parts of the country, like the Copper Belt, in addition to the Lusaka district where this surveillance was based. Next slide, please. Next slide, please. Okay. So our pilot's surveillance did not go. The previous slide, please. Did not go without challenges. So we had two major challenges. So this was one of them was delayed confirmation for the availability of the funds for the project. Then the other one is that we are looking to expand to other sites as well as other pathogens. However, funding is not yet secured for this. Next slide, please. What did we learn from this? So we learned that there's need to do capacity building through technical assistance. So this was critical to ensure that we had an effective and efficient pilot project. And then we're able to learn lessons from this. And then stakeholder collaboration was very key, and it enhanced how this pilot ran through smoothly without major hiccups. And then we had stakeholders coming in whenever there was a need to. Then also the planning for the protocol development and the approval process. Then there's also need to address timely procurement and supply to ensure that there's no delay. We're lucky that labs had some of the procurement in place before the project. And then also allocation for sufficient resources for the program to expand is essential for sustainability of wastewater surveillance in Zambia. That is with regards to testing for multi-pathogen and also the coverage, in this case, to other parts of the country. Next slide, please. So I'd like to acknowledge the Ministry of Health, the Zambia National Public Health, SHAS, our water supply and sanitation companies, and also the Genomic Sequencing Consortium. And lastly, but not the least, the Association for Public Health Laboratories. Thank you. This ends my presentation.
A big thank you to both the church as well as the Zambia team for those great and exceptional presentations. Very impressive, lots of lessons, and we can see science driving surveillance activities in between wastewater testing as well as clinical sampling. We now take this opportunity for questions and answers. And those of us who would have questions and have not typed them in would also be free to raise your hands, and you'll be given an opportunity to raise your questions. So again, just to let you know, we are open and will be extending the discussions for a further 10 minutes, ending 10 past 12 CET, for those of us who can remain behind to listen, given that we have taken a substantial amount of time. So starting off with a question, or anyone with hands raised? I can't see any hands raised straight away now, so I'll proceed to read the questions. A question by Osborne Otieno: what are the sustainability approaches being adopted across the Stellar countries to ensure ownership and continuity of the gains on lab system strengthening and wastewater surveillance? This is critical to ensure countries do not regress on the key lab interventions, such as quality management systems, sample referral systems, LIS, as well as governance, amongst others. Question 3 by Pascal. Very nice presentations. As far as lab information management system is concerned, does the laboratory use it to manage all data or just a few well-defined items? Regarding accreditation, please note that SLIPTA is not an accreditation system, but a certification system. Note also that there's a guide to implementing a national quality management system endorsed by Africa CDC. Congratulations on your success. Thank you. Any responses to those questions? The ASLM and providers, as well as presenters and the larger Stella community in the room.
Well, thank you so much, Osborne, and thank you so much, Dr. Pascal and everyone for the questions. We'll, in the interest of time, we try to answer them, and then I also let the APHL team respond to any.
Yeah,
so in terms of sustainability, I think that's a very important perspective that we need to pay attention to, but we'd like to flag that, like we indicated in the beginning, our implementation of this TA is that we are working under the stewardship of the Ministries of Health Lab Directorates and involving the designated technical working groups in implementation of these TA activities is within the already existing structures of the Ministry of Health. And we know that these structures live beyond the project. And first, to explain the element of governance, you realize that in one of the slides we showed you that we supported the development of different policy and governance guidelines. These guidelines, some of them are national laboratory strategic plans, some of them are policies, some of them are testing guidelines, and many others. Most of these national guidelines are living beyond Project Stella, and they give a general strategic direction to these lab directorates. So in that way, that is sustainability. The other way we are doing this, and in one of the results that we showed you, is the training that is building capacity of the Ministry of Health Lab personnel. And in that way, we know that long after the project has gone, these personnel will remain around performing all these activities. Also, of course, we've talked about the data systems integration, building in the informatics, the NHGS that the team has talked about. So in that way, and continuous advocacy, we are confident that we'll be able to have these gains made to lie beyond the project. And you've seen in one of the recommendations from the wastewater-based surveillance bit where we are planning to have this transition beyond the bioinformatics of wastewater, but for diagnosis of other pathogens. So that's what some of the ways. In regard to the QMS comment raised by Dr. Pascal, thank you for that clarification. And indeed, we are cognizant of that, that SLAMTA program is actually a certification program, not necessarily an accreditation, but it's simply a system through which an initiative that supports the labs to move towards accreditation. But also maybe allow me leave the Chad lab director of Zambia or colleagues from the Project Stella to respond and provide any. Thank you. Back to you, Osborne.
Yeah, I welcome Dr. Bakar to react. There are actually two questions. Is the LIMS from Chad open source or commercial? If commercial, how is the annual licensing being managed? Then the issue of strategies to achieve interoperability at all levels, both local, national, and lower levels. Thanks.
Merci beaucoup pour.
Thank you very much for all your questions. I think that the first question is about digitalization in the end. In a country, we've chosen the software that you've seen, which is an open source software, which is accessible, and you can download it on the internet. It's software developed by a foundation, and it is used by different countries. At a national level, that is to say, in a national reference lab network, because we lack public health labs, well, then we have a decree which talks about the role of the reference labs. And so that's how we trained the technicians of this network on the software. And now we are installing this software and including all the necessary hardware. So we've already started this, and we're just waiting for the funding to implement this software on a national level. And as far as surveillance is concerned, we also have some operating surveillance systems which are set up by a foundation, Santé Monde Foundation, and World Bank funded this, and it's already operational. That is why we decided to choose this other software in the entire country. Thank you. As far as the accreditation system is concerned, I don't think we've reached that level. What we are looking for now is to operationalize overall the digitalization. And as you said in your comment, in order to get the accreditation, you need to comply with different steps. And we're just at the beginning of that journey. And also about the second question, I think on the sample transportation system, we've already drafted in an integrated way the sample transportation system, and that's in collaboration with the Stellar project and the WHO. And also we are now in the phase of implementing this sample transportation system. So we decided to have a pilot phase first of all. In this pilot phase, we will include 3 regions, Guéra, Logan, and Jemena. And we've already produced the terms of reference at the project unit. So this will be managed with the Global Fund. And so that's where we stand now. And we hope that in the near future we'll be able to implement this pilot phase. Thank you very much.
Thank you so much, Dr. Bakar. We have a few more questions on the chat box. I'll quickly go through them. So kindly take notes so that both the presenters can react. One question to the Zambia team. Great. You have already typed them out. So Zioda, you are okay? I just read through the questions on the slides, or I go through the chat box?
No, we have collected the questions for you from the chat in the slides, so you can go ahead and read it. Thank you.
Great, thank you. So to the Zambia team from Michael Juguna, well done to Zambia on the wastewater. As regards the recent cholera outbreak, what synergies does this project provide? Then the question to Dr. Bakar, I think you have highlighted and responded to that question already. A question from Harriet Namanya. Some of the sustainability approaches being applied in Uganda is integration of project cell activities into the existing structures and building capacity of personnel at all levels. That is more of a response. Thank you for that. Then a question from Nebrete. Helpful if you can clarify how the positivity results from wastewater surveillance samples are being used. And I'll couple that up with a question from Dr. Pascal to Zambia team. Great slide comparing the peaks in water and clinical samples. Is there a way to model the peak in water to peak in clinical specimen? How is public action taken? Who and what from these results? So maybe you can take up those round of questions. Meanwhile, I'll be skimming through if there are more questions. Thank you. Dr. Chilufi and the Zambia team, are you able to respond? Dr. Chilufi and the team, are you able to respond, or the APHL team can jump in?
So Osborne, it seems Dr. Chiluya seems to have dropped. So she might not be hearing us. She seems to have dropped, maybe. So maybe APHL can help chip in here.
Dr. Noah and the APHL team, are you able to jump in?
Maybe to check with the Zioyad, maybe they don't have, given that they are attendees, maybe they don't have audio, maybe he could type in the chat the response. Thank you.
Okay, so to the APHL team and Zambia team, if you are not able to speak up, you can type your comments into the chat. Dr. Bakar, I see your hand up again. Do you have a question or a response?
Osborne, I see Doreen is online. Maybe Doreen can respond to some of the questions.
Je pense qu'une ancienne mère, je m'excuse.
I'm sorry, it says Mr. Abakar. Yes.
Thank you, Dr. Bakar. Doreen, are you able to chip in?
Maybe she doesn't have access to speak.
So Noah has put in the chat that he's requesting to be unmuted. I think he would have spoken, but he's not able to talk. So maybe we unmute.
Ça, c'est informatisation.
Marcella, are we able to unmute Dr. Noah Hall?
Copy that. We have unmuted Doreen, and we will give permission to speak to Johannes right now.
And again,
sorry, I didn't get the question.
So
what
the
was
question,
the question again for Zambia?
Yeah, the question is, as regards the recent cholera outbreak, what synergies did this project provide?
Sorry, we can't translate anything right now.
Someone must be connected to more than one gadget. The second question is, it would be helpful if you can clarify how the positivity results from wastewater samples are being used. Another question from Mr. Juguna is also beyond wastewater. Is there comprehensive testing of borehole water in compounds or water supply using these surveillance tools? So kindly, you can go ahead and respond.
Okay. Sorry, I've got a cold. I'm actually home, but I'll try to respond on the first one. I think concerning how we are leveraging with the cholera, is that the question?
Yes.
I think that's the idea. Of course, yeah, that's the idea. And what we want is that right now we are doing this wastewater surveillance. It was mainly looking at viruses and SARS-CoV-2 in particular. And the idea is that this should be able to build on, we should be able to actually build on and do more than what we are doing, just looking at viruses, but want to extend and look at core. So this was in the scale-up phase. We are now actually riding on more priority pathogens that we can detect using wastewater, because the system is already set up and we are building on from viruses to AMR and other priority pathogens. So that is the strategy that is the direction that we are taking. yes, during the cholera outbreak, I think we sequenced some isolates, but it did ride on the wastewater. I think these were clinical samples that were sent to the labs, ZNPHI and CHAS, and we sequenced, and data is being analyzed at the moment. I think if there's somebody from ZNPHI can give more details on that. But bottom line, we want to continue. We are going to build on. This was the first step, but we are building on what has already been laid. The foundation is already there for surveillance for other pathogens of public health importance. The other question was on what?
If you can clarify how the positivity results from wastewater surveillance samples are being used to inform public health action.
Okay, yeah, I think the data is being involved because you see, we didn't start. We were doing these surveillance works, and we are also monitoring. Remember now, because the cases have gone down, we are only looking at surveillance now to see where are we in terms of positivity. But what we saw is that the moment we started reporting an increase in the clinical cases, I think the chart was very clear. The months when we started seeing a number of positive cases in wastewater, we also were able to infer the positivity that we started seeing clinically. So that showed you that there was that connection between what we are seeing as surveillance people in wastewater and clinically how the possibility also started going up. I think there's a chart that we showed that actually showed that correlation. So with surveillance, it's a continuous thing, but we can be able to give signals that, look, there's something that we are seeing here. And in most cases, it correlates very well with what we see on the ground, clinically speaking. So we are able to inform police with whatever we are doing. And basically, that's the idea, really. It's not just doing surveillance for the sake of it, that the data that we are getting, how does it inform policy, and how does now the Ministry of Health utilize that data that we are getting from the surveillance works that we are doing. I hope I've tried to respond.
Thank you so much, Doreen. And a final question to the CHAD team, Dr. Bakar and your team. Implementation leads encourage countries to measure the impact of documentations developed through Stellar. Team CHAD, please share your experience on this. What indicators did you use to measure the impact of the documents developed? A final quick response.
Merci beaucoup pour la question.
Thank you very much indeed for your question. In our country, we try to use the platform in the labs. It is used at the Ministry of Health by quite a high number of directorates, the central and provincial directorates. And so then we are going to incorporate all the different labs onto the platform to centralize all the data. That's our idea. Thank you very much.
Thank you so much for the response. I think we are running out of time, and I want to pass a big word of thank you to the presenters, as well as to the attendees, our country team colleagues, all the Stellar countries, the communications team for doing a superb job organizing this meeting, as well as providing us with the translation services. It is very obvious the presentations and the quality of work is quite impressive, and we look forward to future opportunities to showcase and share the work being undertaken in Stellar and what the other countries are also seeing as success stories. We wish to bring this information session to an end. Thank you so much. Have a wonderful day, and looking forward to interacting with you again in future. Thank you and bye.